This month's learning brief focuses on the critical role of language in case notes and recordings, emphasizing its impact on children, families, and professional practice. Language is not just a means of documentation, it is a reflection of professional judgment and understanding. When used effectively, it can validate the voice of the child, foster empathy, and guide trauma-informed interventions. Conversely, poorly chosen language can inadvertently place blame, obscure context, and risk further harm to the child. The words we use in case notes can significantly influence perceptions, decisions, and outcomes for children and families. Poorly chosen language can increase the risk of harm. Blaming language can lead to a child being scapegoated or ostracized within their family, particularly by parents or siblings. It can also undermine the voice of the child. Behaviors are often a way for children to express distress or unmet needs. Failing to capture this accurately risks minimizing their experiences. Additionally, it can create bias in future practice. Documentation that assigns responsibility to the child can lead to prejudiced perspectives, hindering future professionals from taking a trauma-informed and supportive approach. Trauma-informed and reflective documentation recognizes behaviors as meaningful communication and emphasizes professional curiosity to explore deeper causes. Language that implies blame, unhelpful language. The intervention is necessary due to Johnny's presenting aggressive behavior. This use of language isolates the behavior and implies that the child is the problem without exploring contributing factors. Reflective alternative. Johnny's behavior appears to indicate distress and may reflect challenges within the family environment. Professional curiosity is required to explore both the evidence and the dynamics contributing to his experiences. Understanding this context will help identify appropriate support for Johnny and his family. This alternative avoids blame and reframes the behavior as meaningful communication. Focusing solely on behavior, unhelpful language. The family is struggling because of Johnny's refusal to engage. This use of language suggests that the child is solely responsible for family challenges and ignores relational and environmental influences. Reflective alternative. Johnny's reluctance to engage may indicate underlying issues. Exploring the family's current challenges and understanding how these may be affecting Johnny is crucial to providing effective support. Overlooking family dynamics, unhelpful language. Johnny's behavior is disrupting the family household. This risks reinforcing a narrative that scapegoats the child, overlooking the relational and systemic factors at play. Reflective alternative. Johnny's behavior may reflect emotional distress, influenced by instability within the household. Professional curiosity is essential to understand the family dynamics contributing to this distress and identify appropriate supports. Scenario 1. School refusal and family instability. A 9-year-old child, Chloe, has been refusing to attend school for several weeks. Case notes suggest her behavior is disruptive to the family routines and reference parental frustration, unhelpful language. Chloe is refusing to attend school, which is causing stress for her parents. Reflective alternative. Chloe's school refusal may indicate emotional distress related to recent family instability. Further exploration of the family environment and Chloe's emotional needs is essential to identify appropriate supports. This alternative emphasizes Chloe's experiences and needs while acknowledging the family's challenges, fostering a supportive and collaborative approach. Scenario 2. Behavioral issues following domestic violence. A 7-year-old boy, Ethan, has been displaying aggressive outbursts in class and at home following exposure to domestic violence. Unhelpful language. Ethan's aggressive behavior is disrupting his learning and the household. Reflective alternative. Ethan's aggressive outbursts appear to reflect distress related to exposure to domestic violence. Professional curiosity is needed to understand how his experiences have affected his emotional well-being and to explore interventions to support both Ethan and his family. This alternative shifts the focus from labeling behavior to understanding its roots, encouraging trauma-informed responses. Professional curiosity is critical for effective practice. It involves exploring beyond the surface, asking what the child's behavior is communicating and what the evidence tells us about their experiences. Contextualizing behaviors, considering how family dynamics, environmental stresses, and systemic factors influence the child's behavior. Avoiding assumptions behaviors should not be labeled or dismissed, but seen as part of the child's narrative, requiring further exploration to uncover underlying causes. Reflective questions to guide professional curiosity. What is the child's behavior communicating about their experiences? What evidence supports my understanding of the child's needs? How might systemic or relational factors influence the child's current presentation? Have I considered my own assumptions and biases in interpreting this behavior? Reframe behavior as communication. Reflect on what the behavior is telling us about the child's experiences or needs. Unhelpful, the child is disruptive and refuses to listen. Helpful, the child's behavior suggests emotional distress, possibly reflecting challenges in their environment. Further exploration is needed to understand their needs and provide support. Family dynamics. Recognize that behaviors are often influenced by relationships and the family environment. Unhelpful, the family is struggling because of the child's behavior. Helpful, the family is experiencing challenges in managing the child's behavior, which may reflect broader family dynamics. Support is needed to address these dynamics and help the child feel safe and supported. Avoid judgmental language. Replace statements of blame with objective, empathetic observations. Unhelpful, the parents are failing to manage the child. Helpful, the parents are facing difficulties in responding to the child's behavior, highlighting the need for additional support and alternative strategies. Prioritize the voice of the child. Consider how the child might feel reading their case notes. Does the language validate their experiences or place blame? Unhelpful, the child's actions are the reason for professional involvement. Helpful, the child's behaviors reflect distress, highlighting the need to explore how their lived experiences are affecting them and how we can support them and their family. In brief, it is important that we consider our use of language in our recording to ensure blame is not placed on the child.